All right. Thank you all for being here. We're so excited for our second year of LADN's financial grant program. I'm going to go ahead and share my screen so that we can go over to the application. So I've just started off by putting us at our general website, la-dn.org. And from there, you can go to the top of your screen here. You should be able to see something that says grant program. So click on that. And this whole page gives you some general information about the program. And it also gives you a link to the application. So we're going to head over to the application now, assuming my internet works. Great. Alrighty. So our grant program was created to help ease the financial burdens of dysautonomia patients living in Los Angeles and California. So these grants cover dysautonomia-related healthcare expenses that aren't covered by insurance for dysautonomia patients in California who demonstrate a financial need. So this year we are awarding 10 grants of $1,000. And our applications are open now through October 14th at 11:59 p.m. So at the end of the day on Monday, the 14th of October. So let's talk a little bit about eligibility. So in order to be eligible for this grant, you must have a dysautonomia diagnosis. And so I will show you in a little bit. We have a very simple form that you will need a healthcare practitioner to fill out. It just asks them to write your name, your date of birth, yes or no, and to sign their name and information. So that is definitely the first thing that I would recommend you get started on, because you never know how long it will take a healthcare practitioner to respond. And that is sort of the one part of this application that requires help from somebody else. All right, so other eligibility, you must be a California resident. So you do not have to be in Los Angeles, but we will be allocating 50% of our grants to LA County residents, and then the rest can go to anywhere in California. And then you must demonstrate financial need. So this year we are defining that as 350% of the federal poverty level. So I'm going to pull up a calculator here and show you how you can calculate that. So this depends on a couple of things, mainly the size of your family and the size of your family on your tax forms. So if you file as an individual, then you'll keep this one here, and then you will put 350 in here, click calculate, and then on the left here, you can see this 52,710 number is the threshold that would make you eligible. So if your annual income is around there or below, then you're eligible. So there's some other, obviously you may have other family members, say you're a family of 4, then you just change that number, put in 350 again, calculate, and that shows you the number here for your entire family's income on your tax form. Another question that might come up is if you are an adult, but you are claimed on somebody else's taxes. For example, for many years, I was considered an adult disabled dependent, and I was filed under my parents' taxes. So in that case, the number would be the number that your parents on your parents' tax form. So then if it were, say, 3 people, you'd do 350 and calculate there. So if the number is close, say it's a family of 3 and it's 92,000, you're still welcome to apply. We will, part of the application will be sort of a cohesive analysis, so that will be part of your application. But yeah, and you can also ask us any questions at the end, or send us an email if you are unclear about calculating that number or your eligibility. All right, other eligibility things, you must have a social security number. You also have to have some documentation of dysautonomia care-related expenses. So I'll show you later on in the application where that will come up, but those are things like a receipt for a medical expense, some type of documentation to illustrate what you would use the grant money for. So participation in our community is not required, but it is something that we may take into consideration. That'll just be part of the whole conversation that the grant selection committee has. if you have applied previously, or if you have even received a grant previously, you're still eligible to apply. We may give priority to people who have not received any funding previously. So that covers it for eligibility. Confidentiality. We definitely take your privacy very seriously. This application is on JOT form. So it's served, it is stored on JOT form's HIPAA compliant servers. And then additionally, the only people who have access to your full application would be me and Emily Sunez, the outreach director of LADN. So LADN staff are the only people who have access to the full application. And then we will redact any personal and demographic information when we share it with our grant selection committee. And then if you are a grant recipient, we will not share that information publicly unless you choose to share it yourself or allow us to share it, but it will not be shared without your consent. Okay, I see there's a couple questions in the chat. I can't really see them because I'm screen sharing, so I'm gonna wait till the end to answer them. And Emily, if you see anything that needs to be addressed now, just go ahead and pop on camera and let me know. Okay, so the way that all these applications will be analyzed, as I mentioned, we have a grant selection committee, and I'm just gonna run over to our website to show you who they are. We are very grateful to have some volunteers join us this year. So we'll have all these people listed here, and they are volunteering their time to help us evaluate the grant application. And we're going to be basing our evaluation on this rubric here. And this is available for you to check out. This link that I just clicked is on the first page of the application, so you can pull it up yourself and check it out. I will go through this in more detail when we get to the application. As you see, different parts of the application correspond to the rubric. So every member of the selection committee will be assigned a certain number of applications, and they will evaluate and score these rubrics. And then they will turn it all in, we'll run the numbers, and then have a committee meeting to discuss who should be awarded the grants. And it will depend on the number of grants that we receive this year, but every application will be read at least 3 times. Last year, every application was read at least 4 times. So we'll make sure that, we're evaluating, every application is being read, and we're having a conversation about who should get the awards. Okay. And we are very committed to inclusivity and diversity. As I mentioned, all personal and demographic information will be redacted in the analysis of these applications. Okay, so what healthcare expenses are eligible? This is not an exhaustive list, but some of the things that might be covered include acupuncture, copays, health insurance premiums, infusion expenses, etc. Some of the expenses that are not eligible include general food expenses. This does exclude supplements, electrolytes, medically directed nutrition, etc. But it does, expenses that would be ineligible would be, for example, Postmates or grocery delivery. We do understand that dysautonomia can be really disabling and cause you to have those types of expenses. Certainly does for me. But given that we have such limited funding at this time, we're only funding expenses that are related to dysautonomia healthcare specifically. So other ineligible expenses include rent and general automobile expenses. This would exclude any direct travel costs. So if you have to drive a really long distance, your gas could be an expense that you apply to for this grant. Similarly, if you have to travel, you could also apply to have the airplane costs covered. And like I said, you're very welcome to email us at ladn@la-dn.org with any questions if you're wondering if a specific expense is eligible. Alrighty, so the application is open until October 14th, unless we reach a limit of 100 applications, in which case it might close sooner. And then we will make our decision and let everyone know by December 6th. Okay, so we have this workshop here right now, and then we will also on Sunday, October 13th from 12 to 1 p.m. have an office hours event just for any last minute questions. And like I said many times, you're always welcome to email us. Okay, so I'm going to go ahead and this just sort of gives you an overview of the application. So I'm going to go ahead and jump into the actual application. This is the first page. You got to click yes that you've read everything, and then you can move on to filling things out. All right, I'm going to fill out today a sample application. So I'm going to use our business address. And you will, of course, fill out your name and address, and do make sure this is an address that you will have access to. Okay, that you will have access to in December, as we might need to send the grant award to the address. Just gonna fill out a fake number here and email address. Okay, you gotta certify that you have a social security number. And now we need you to upload California residency documentation. So the easiest one is probably going to be a driver's license or passport. You can also do a pay stub or utility. I'm just going to upload our logo for ease. Okay, and then this year we're going to be awarding the grants through Zelle. So if you're not familiar with Zelle, it's a type of online wire transfer payment. So it's usually connected with your online bank account. So if you have an account, it's usually your phone number or your email address. So hopefully you can you have one of those and can put that there. If you do not have one, that's totally fine. We can send a check. So just if you don't have one, put NA, and we will use the address that you provided above. All right, you have to fill out some demographic information. And as I mentioned, this will be redacted during the analysis of the applications. This information is just for us to take stock of who we are helping and make sure that we are getting the help out there to the people who need it. So I'm going to fill this out with LADN's birthday, which is 2018. And all right. Moving on to the next page. So please select which type of dysautonomia you have. If it's not listed here, you're welcome to click other. And if you have multiple types, please go ahead and click multiple. So here is the dysautonomia diagnosis form that I mentioned. This is just to let us know that you have dysautonomia and that's been certified by some type of healthcare practitioner. Can be a physician, physician assistant, nurse practitioner, registered nurse, etc. So they'll just fill out your name, date of birth, circle yes, signature, provide their name, address, and telephone number. This is just to ensure, because we won't know everyone who applies, so that we know that the money is going to people who have dysautonomia. All right, so financial information. This is where you'll be filling out the info that we talked about when we were on the FPL calculator. So if you have one person in your household that you fill out on your 2023 tax form, then you put one there, and you'll put your annual household income. So this is your annual household income from 2023 from your most recent tax return. We'll just say, let's say 40,000. And then you're going to put your projected income for this year. So if that's, if nothing's really changed, you think it'll be the same as 2023, then go ahead and put the same number. If, however, something has changed and you have a different income, and what you think will be a different income for the rest of the year, go ahead and put that number. So if there is a difference, then we ask you to just provide a brief explanation as to what that difference is. Does not have to be super detailed. I'm just going to put in an example here. So say March 2024 experienced such disabling symptoms that I had to start working remote half the time. Because of this, I'll have earned half the income. Apparently in the sample that we created, it was 2030, but yeah, so just give us some sort of brief explanation saying there has been this change. If there has not been a change, you don't need to fill out this section. All right, so we will need you to fill out to submit the first page of your Form 1040, your tax return from 2023. And I can go ahead and pull that up. Let me just, oh wait, I don't think it's gonna let me since with the screen sharing, not sure how to get it to show that, but let's see, maybe I can do page 1 of 1040. All right, there we go. So the number that you're looking for, it is down here. We want your, pretty sure that's the number we asked for. Yep, line 11 of the 1040. So you'll find that this, hopefully everyone has filled out their 2023 tax return, or the people who claim them on their tax return has done it. So we'll need the first page of that. And then next, if you did have an income change, we'll need you to submit some type of evidence of that income change. So it could be your most 2 recent pay stubs, if they illustrate an income that's less than the previous year. And if you have specific questions as to what would qualify, you're welcome to ask that at the end or send us an email. Okay, so moving on. Oh, I forgot to. If you don't submit one of the things, it will tell you that it's required. So putting in the dysautonomia diagnosis form, moving on to the next page. Okay, so now we have our essay questions. So the first one is, how has living with dysautonomia impacted your life? Please use specific examples such as changes in health, ability level, life goals, career, social life, finances, etc. So as I mentioned, the analysis of your, where is it, right here, of your application is based on all of your responses, mainly the essays. So this first part in this rubric, we're looking at your first essay. So we'll rank it on a scale of 1 to 5, and the 5 category for this says an applicant clearly articulates how dysautonomia has overwhelmingly affected their life with specific examples of its significant impact. So we're going to go ahead and put in a sample essay, and we'll walk you through some of the things that we are looking for. So first off, remember that we don't know who you are. Even if, for example, even if you know me personally, when we are analyzing, going over all the applications will be identified by a specific number and not by a name. So we won't know anything about your situation. So we need you to tell us that in your application. So in this essay question, we suggest you introduce us to you and your situation with dysautonomia. So I've written these for a made-up person, so this is not my situation, this is just an example. So in this example, I got dysautonomia 3 years ago after having COVID, and it turned my life upside down. I went from being an athletic, career-driven person with an active social life to someone without the energy to wash her hair, let alone work. It has totally derailed my life and my life goals. So just sort of an introduction to the dysautonomia impact and sort of a contrast between how life was, how life is now, and some of the things that are important to you. So now we're getting into some more specifics of your health impact. So talk about symptoms, for example. My symptoms of severe brain fog, extreme fatigue, and GI issues make it hard for me to do anything. I'm constantly exhausted and I don't feel like myself. I love to write, but my brain fog prevents me. I love to play tennis, but if I try, I faint on the court. I'm constantly trying different elimination diets to find foods that don't make me feel ill. I feel like my life is full of triggers that make me feel so ill, and I'm both physically and emotionally exhausted by constantly being ill and trying to feel better. So don't be afraid to tell us what it's really like. We all know dysautonomia is really hard, and we want to know why it's hard for you. So give us some specifics about the things you go through, how it makes you feel physically and emotionally, if you'd like to share that. You can also share how it has impacted your career. So in here, we've got my illness has prevented me from working. I was unable to continue working as an editor because my brain fog made it impossible for me to focus on the content I was supposed to be editing. I also kept getting viruses at the office, which would set off flares and keep me home on bed rest. So I'm going to go back to this again and again, but we want specifics, because specifics really help paint a picture as to how dysautonomia has impacted life for you. And then you can go into how it has impacted you financially. Unable to work, I've had to turn to the support of my parents for help that they cannot afford to give. I'm not well enough to support myself fully. My medical costs are higher than ever, and I need extra costs such as grocery deliveries. So like I mentioned earlier on, expenses such as grocery deliveries aren't eligible to be covered by this grant. But if those are expenses that dysautonomia has raised for you, it's really helpful for us to know that, because it helps us know just what you're facing financially. Okay. Other things, tell us about how it's impacted other aspects of your life, like social life and life goals. Dysautonomia has gotten in the way of my social life too. I've had to cancel on friends so many times that it's gotten in the way of friendships. I want to find a romantic partner, but I don't have the energy to date, and I don't know how my chronic illness will impact a relationship. So there might be some things that are very common to the dysautonomia experience, and maybe you assume that we know that, but tell us anyway. Okay, so again, specifics. We want you to tell your story as specifically as you can. If you can, provide a contrast. Tell us what your life was like before and how it has changed because of this dysautonomia impact. Yeah. Okay, so we will move on to our second essay. Before we get to that, we want to mention if it is hard for you to write these essays, which could very well be, brain fog being a very common symptom, you are welcome to record an audio answer or a video answer and submit that here. If you do that, just write C recording in this box and we will analyze it based on that recording. Oops. Other option too is if this is too much of a challenge to come up with responses yourself, totally fine, totally understandable. You're welcome to have someone fill out this application on your behalf. Okay, moving on to essay question 2. Why are you applying for a LADN grant? Please describe any resources and help you currently utilize, the overall costs of your need for financial and your need for financial support in your dysautonomia care, and how this grant would fit into your care plan. So this is part of the second row here on this rubric, which covers your need for support. So it will be this essay, and then additionally, we'll take into consideration your financial information, such as your annual income, and the total cost of dysautonomia expenses, which I will get to shortly. An exceptional score on this subject would be applicant demonstrates an exceptionally compelling need for support. Okay, so once again, we have a sample essay. So got some overarching statement here about why you're applying for this grant. So here we have, I am applying for this grant because I cannot afford the high costs of my dysautonomia medical needs while being too ill to work. Let me get into the specifics. What would you spend the $1,000 grant on? Specifically, I would use $1,000 grant to pay for compression boots and the co-pays on acupuncture and my prescription for chromalin sodium. So simply tell us what you would use the money for. And this could be an expense that you have incurred in the last year, or it could be an expense that you would like to pay for but have not yet. Okay, tell us what else your dysautonomia care costs are. So other dysautonomia related medical expenses that I must pay include copays to see all these doctors, copays on the other prescription medications I take, and tell us, like I said, we want specifics, so tell us what other doctors what other types of doctors you see, and then what other types of medications and other treatments you do, like over-the-counter medicines, compression socks, electrolytes. We just like to know what other things you have to pay for. And then tell us a bit about your overall financial situation. So here we have, I had some minimal savings from when I worked, but I have drained my savings while I've been too ill to work on things like high medical expenses and living costs such as rent and groceries. All right, next, you could tell us what other support you receive or need. So I rely on support from my parents to afford groceries, but they don't have the financial situation to support me either. If it weren't for my mom helping me with things such as laundry and even in extreme flares, helping me shower safely, I would need in-home care. I have applied for government assistance, but it is barely enough to cover rent. So this just gives us a bigger picture of what you're going through. There are lots of things that dysautonomia causes in a person's life, that some of which can be measured with a number, some of which is a burden that is not measurable. So we just like to know more about your situation so we can fully analyze why you need the support and determine whether to award you a grant. Okay, and here's this next part of this second row, need for support. We would also like you to tell us, to give us an estimate of how much your dysautonomia healthcare expenses has cost in the last 12 months. So as we said, this is an estimate. My suggestion is to, if you have regular expenses, to add up all of your expenses in a month and multiply it by 12. If you have some expenses that are like bigger one-time expenses that you've had in the last year, add those in after you've done that 12-month estimate. So it both gives us a bigger picture of what you're going through, and it lets us know and lets our, when we analyze and when we report data to everyone, our funders in our community, it lets everyone have a sort of a number to visualize just how much dysautonomia costs for everyone, because we know it costs a lot. We know this is really hard, and this is data that helps us put a number to that burden. So I'm going to say 4,000 just because I gotta put something in there. Well done, all errors fixed. All right, I'm going to take a sip of water here for a second. Okay. Now this is a lot to just throw at you. This is our last essay question. Essay question number 3. Please describe the impact $1,000 would have on your dysautonomia healthcare. You will be asked to fill out a spending plan table below, and then there'll be space to provide documentation of expenses in the next section. Going back to this rubric here, we're on to the third row, dysautonomia care plan. So an exceptional score would be, no, sorry, my dog is hopefully not about to bark. So an exceptional score on this would be applicant clearly and thoroughly identifies how the grant award will directly support their dysautonomia care with a specific plan. So once again, the theme of this application is be as specific as you can. All right. Let's get the third essay here. Okay, what will you use the grant for? This grant would allow me to purchase Fit King compression boots and pay for 2 months of co-pays with acupuncture and cromolyn sodium. So in this example, they're paying for 3 things. one, a one-time purchase of a piece of medical equipment, compression boots, and then those next two for 2 months of an acupuncture treatment and then a prescription. So then let us know how these things will impact your health. So first, we're going to start with the compression boots, the number one thing we've asked for, or we're saying that we would spend this grant for. And we're now going to explain why we need it. So I struggle with extremely low cerebral blood flow and often have episodes where I cannot speak and am near fainting. During these episodes, I have to lie down with my feet up, drink electrolytes, and use ice packs to try and restore adequate blood flow to my brain, but this isn't enough. My doctor thinks these compression boots would help restore my circulation and pump the blood back up to my heart and brain. My doctor also hopes that using these regularly will help me maintain better health overall and prevent these extreme dysautonomia episodes. So this tells us why you need, why this money would have a big impact on your healthcare. Again, specifics. And it's nice to know that like this is backed up by a doctor. So you can mention that it's recommended by as part of your healthcare plan. I also have acupuncture as an example. So I found that acupuncture really helps me with my energy levels and low blood pressure, but I cannot afford regular treatments because my insurance only covers some of the treatment. Acupuncturist recommends that I come in at least weekly, and this grant would allow me to have weekly treatments for 2 months. I'm hoping this would allow me to strengthen my energy levels and start making progress with the overall, with the low blood pressure caused by my dysautonomia. So not everyone who's on the grant selection committee will be familiar with all dysautonomia treatments. So there are a lot of different dysautonomia treatments, especially because we don't really have a one cure-all, do we? So it definitely helps to know why the specific thing you're asking for is related to your dysautonomia healthcare, and that you don't have to prove it to us, but we need to know that for you it would make an impact on your dysautonomia. Okay, so tell us why you want why each thing you're asking for would have an impact on your health, and then describe the big picture impact this grant will have on your health. First, we want specifics, and then it's nice just to have a statement about overall how it will help your health plan. So here we have, my hope is that with the compression boots, acupuncture, and cromolyn sodium, I will be able to address my largest dysautonomia symptoms, low blood pressure, extreme fatigue, and brain fog. This grant would enable me to start making progress with my dysautonomia and improve my health significantly. So this is just a way to bring it all together, and you are telling the grant selection committee a story about your life. You're informing them about the reality of your situation and telling them that this money would have a big impact. All right, so that is it for our essays. And then next we ask you to fill out, this sort of corresponds to the information that you've provided in your third essay, but we ask you to fill out the spreadsheet about your expenses, what you are asking to pay for. So in this situation, in this example, we've asked for compression boots. And we are going to, we're specifically asking for the Fit King brand. So we want you to tell us what the expense is, what the doctor or the company is, whether if the date of cost or projected. So that's asking like if you have purchased it previously, or if you're about to. So we'll say that we have not purchased it, but we intend to do so like as soon as we get the grant money. So we're going to put December 2024, which is when the grant would come through. And then let's say it costs $35.99. So we put the cost of the individual item in this column. And then in the next column, we put the total cost that we've asked for so far. And so far, that is just that one cost. Next, we are asking for acupuncture. And I'll put where I go, acupuncture therapeutics. And then these are projected costs, so we're going to put December and January of 2025 because we've estimated that this grant would allow us to pay for about 2 months of service. And with those copays, we're going to say that that's $400. So that would be the total expense over 2 months, bringing our total to $759.99. And then we're going to go Cromwell, and we can say doctor/CVS and December 24 and Jan 25. And that would be 250. And so adding that up, it would be just over 1,000. So in this space, we want you to we want this to correlate to what you've said in the previous essays, specifically essay number 3. But this is adding up the numbers. So we want you to ask for, or we want you to state that you would use this money on expenses that add up to roughly $1,000. I would definitely suggest if it's either above or below, you want to make sure that you're asking for more than 1,000. It doesn't have to equal exactly 1,000. But it'll be a stronger case that you need this money if you're telling us that you would fully use the money. So definitely fill up enough to reach that $1,000 level. All right, next we ask you to just click the link or click the boxes to tell us what you're using it for. So in this, we've asked for acupuncture, compression gear, copays, and prescription costs. If it's not listed here, that's totally fine. We're not going to judge based, it doesn't have to, it's not better if it's on this list. We just came up with some of the common things that might be, and if it's something else, you can click other and type it there. All right, next we need you to upload documentation of these expenses. So that would be things like for the Fit King compression boots. Hopefully you can see here, this is just a screenshot of the Amazon page for these boots. It tells us the price and that it's also listing compression boots, the brand that's we've already put in the application, and the price. So we're going to upload that. And then I would also, I don't have examples here, but we hope that for your other expenses, you may have things like, for example, if we were doing the acupuncture copays, then maybe we have a receipt from a previous time we've been to see them. If it's a new expense that you're hoping to start treatment for, then you can get a letter from the practitioner. You could also get a pamphlet from the place that tells us the amount that it would cost. So that's the other thing that might take a little bit longer, that might be dependent on someone else if you need to get a doctor to write a note saying that this treatment would cost this much. But hopefully you have other receipts that you can put in, just something to let us know that you have had, that the price that you have listed corresponds to the treatment. Yeah. Okay, the last essay, this is not at all necessary, but it's just an optional space. If you have anything else that you want the grant selection committee to be aware of, you're welcome to write it here. We will not look at applications more positively if they fill this out or not. It is just up to you if you feel like there's some piece of information that really tells the story of why you need this money, or if there's something you think was confusing, you can put it here. One example of this might be if you are an adult dependent on someone else's tax returns, you might want to write here that that's your situation and explain why, or if the numbers on the tax return that you have filled out, you feel like it doesn't fully show, tell your story, you can tell us that here. All right. Last thing is LADN participation. Here is where you click the boxes if you have been to any of our events. This just helps us know what events are being utilized. And as I mentioned earlier, there's some chance that we might take that into consideration It definitely won't be a big thing, but if, for example, we're coming, like we've got two applications that both seem equally worthy, we might take it into consideration then. All right. Then this is the last page. Applicant certification. Basically, this is some legalese. Just we want to make sure that you understand what this application is, that you're not guaranteed to be awarded, that we will do the best we can to keep everything, all the personal information private, and it certifies that you have been honest and true with everything that you have submitted. So if you are filling this out on your behalf, you will click this first one. If someone else is, so if you're filling it out yourself, you'll click this first one, and then you will put in your first and last name and the date. If someone else is filling it out on your behalf, you will click, or the person will click the second one, and then they will fill out their first and last name and the date. All right. So that is that. I'm gonna go ahead and do questions now. So I'm gonna, let's see, what's the best way to do that? I'm gonna go over and chat and see what the questions are. All right, so first question here, proof of medical expenses. I have an Excel sheet of medical expenses with location of where expenses are, on which credit card statements, bank accounts, etc. Because they're spread out on different cards and bank statements. Okay, that's great. Looks like Emily already answered that. Yeah, so we need some type of documentation. So those can include receipts, invoices from healthcare services or products. Yeah, okay, one second here. Let's see what other questions we've got. Okay, so for tax benefit program eligibility, is the grant considered a gift or income? So that I think is something for your own tax person to answer for sure. Our understanding is that it is from a nonprofit and that I think it would be a gift, but I'm not 100% sure on that. So it definitely would be something that you would need to consult your own tax lawyer thing for. Yeah, sorry not to give a fuller answer there. If you didn't file taxes in 2023, then we'll need some type of other record of your income. So that could include the W-2 from your job. Yeah, and if you have any, last year too, other people who had forms from, say, an assistance program, like we had someone who had done the food stamp program and submitted some documentation from that program as well. All right, let's see what other questions. Do you count health insurance premiums as dysautonomia expenses? Yes, we do. Yes, all of our programs in LADN are open to people outside of LA. We serve everywhere. We serve all of California. So yeah, all of our in-person events do tend to be in LA because that's where we are located. But our virtual events and our programs such as our LADN Links program are all open to people in California. Okay. Looks like Emily's done a great job of answering these via chat. Does anyone have any other questions? You're welcome to put them in the chat or ask them on audio too. So. Okay, I think maybe we are all set then. If anyone has any further questions, you're welcome to email us at LADN@LA-DN.org. And yeah, we are one more question. Okay, yes, please, Maya, go ahead.
Sorry, my typing is slow. Can I ask it on speaker?
Yes, go for it.
Okay. Um, are the essay, because I tried doing this and it won't let me go forward. Are the essay questions listed? I mean, I can look through this webinar again, but are the essay questions listed somewhere so that I can like write them out before?
Yeah.
Um,
Yeah, theoretically, you're supposed to be able to save it and come back, but I'm thinking it's just letting us
it
save
it
it on
won't
the
let me
last page.
progress to the next. It won't let me progress to the next page.
Yeah.
If I like, okay, I'm still waiting on my doctor's
Mhm.
form, and so it won't let me hit next.
Okay, so the essay questions are on the first page.
Oh, okay.
So yeah, we can also put them on the,
Oh
go
no,
ahead
I
and
just
add
missed
them.
it. Thank you.
Okay, yeah, yeah. No worries. Yeah, theoretically, you're supposed to be able to like leave the application and come back, but I'm thinking it's only letting us do that like once you make it to the last page, which obviously you would have to have filled out the application by then. I suppose you could put in like a couple of words and then save it at the end and come back, but yeah, not ideal. So yes, they're on the first page. Any other questions? Okay. Well, thank you guys so much for being here. We do have planned office hours for Sunday, October 13th from 12 to 1 p.m. And then we are available for any questions via email. All right.